Most men assume that what feels good can't hurt, but here's a shocking truth. Simple everyday masturbation habits could be doing serious damage to your prostate without you even realizing it. Imagine this: every year, hundreds of thousands of older men develop painful prostatitis or even risky prostate enlargement, and in many cases, the culprit isn't age alone, it's the way they're touching themselves. Tonight, you might lie down thinking you've relieved stress, but in reality, you could be setting off a chain reaction of inflammation that breeds discomfort, urinary trouble, and long-term complications. Today, I'm going to pull back the curtain on 6 common mistakes that men over 60 unknowingly repeat, mistakes that can leave microscopic tears in delicate tissue, worsen chronic congestion, and invite infection right where you least want it. And the worst part, these errors are so ingrained that most of us don't even see them. You might be surprised to learn that habits you thought were harmless are silently threatening one of the most vital glands in your body. But before you panic, stick with me. By the end of this video, you'll recognize exactly what to avoid, and you'll understand why small shifts in technique matter more than you ever imagined. Whether you've been self-pleasuring for decades or you're simply curious, this is the wake-up call your prostate has been begging for. Let's dive in. I'm Dr. Henry Carter, a board-certified urologist with over 25 years of experience caring for men's health, especially prostate wellness in patients age 60 and beyond. Throughout my career, I've treated thousands of men for prostate inflammation, enlargement, and chronic pelvic pain. And I've seen firsthand how what we think of as harmless self-care can sometimes backfire. Early in my practice, a patient came to me complaining of persistent discomfort after months of nightly self-relief. He was fit, ate well, and exercised regularly, yet his prostate issues only grew worse. When we dug into his routine, it turned out he was unknowingly applying too much force-skipping lubrication and giving his body no time to recover. Those small repetitive errors had quietly set off inflammation that eventually required medical intervention. It's stories like these that motivated me to dig deeper into how everyday habits impact prostate health. I've reviewed clinical studies, collaborated with pelvic floor specialists, and even developed a questionnaire that helps men pinpoint troublesome behaviors before symptoms escalate. Today, I'm bringing that expertise directly to you so you can benefit from decades of research and real-world experience without having to learn the hard way. By the end of this video, you'll not only recognize the 6 most damaging habits, but you'll also understand why your prostate responds the way it does. No medical jargon, no fluff, just clear explanations from someone who's made it his life's work to protect the prostate health of senior men everywhere. Let's get started. Why prostate health matters after 60. As men age, the prostate naturally undergoes changes. Cells regenerate more slowly, tissues become less flexible, and circulation can weaken. In your 20s and 30s, minor irritation often resolves quickly, but once you cross 60, those small stresses start to add up. This gland sits right beneath the bladder surrounding the urethra, so even slight inflammation can trigger noticeable symptoms. More frequent trips to the bathroom, that nagging sense of urgency or discomfort during urination. Beyond daily inconvenience, chronic prostate stress can lead to more serious issues. Persistent inflammation, known as prostatitis, can foster scar tissue over time, reducing flexibility and worsening urinary flow. An enlarged prostate, or benign prostatic hyperplasia, affects nearly half of all men in their 60s and can escalate into urinary retention or infection if left unchecked. And while prostate cancer risk increases with age, chronic inflammation itself may contribute to cellular changes that raise that risk further. Understanding these shifts is critical because it shows why what once felt harmless, like a quick self-relief session, can have a different impact now. Your prostate is no longer as resilient as it once was, and tiny micro-injuries or repeated congestion can linger, feeding a cycle of discomfort. In the next sections, we'll explore the 6 most common self-pleasure habits that unknowingly accelerate this process so you can see exactly how each one interacts with an aging prostate. Let's take a closer look at that first mistake. Mistake number 1, overly aggressive technique. When you're in the moment, it's easy to ramp up speed and pressure chasing that peak sensation. But here's the problem. The prostate is a delicate walnut-sized gland surrounded by sensitive ducts and tiny blood vessels. When you grip too hard or stroke too rapidly, you create microtears in the prostatic tissue tears that trigger inflammation and swelling. Over time, those microscopic injuries don't just heal themselves. They scar and stiffen, reducing the prostate's natural flexibility. You might not notice an issue after one session, but repeat that forceful routine night after night, and you'll start to feel the consequences: that dull ache in your lower pelvis, the burning twinge during urination, or the need to urinate more often even when your bladder isn't full. Worse still, aggressive technique can push fluid back into the gland, leading to congestion. Think of it like a traffic jam. Instead of flowing smoothly, the fluids pool, creating an ideal environment for bacteria to grow and infection to take hold. This isn't just theoretical. Many of my patients with chronic prostatitis initially blamed everything but their own technique. Aggressive self-stimulation may feel powerful in the moment, but it's a shortcut to persistent prostate discomfort. Recognizing that less can be more is the first step toward breaking this damaging cycle. Next, we'll examine another habit that quietly compounds the problem, one that's almost as common as high-pressure strokes. Mistake number 2. Skipping lubrication. Friction is your enemy when lubrication is neglected. Dry strokes might seem simple, but every unlubricated movement rubs the delicate skin and underlying ducts against each other, causing tiny abrasions you can't see. These microabrasions set off an inflammatory cascade. Your body sends immune cells to repair the damage, swelling follows, and once again that traffic jam effect builds inside the prostate. Without proper glide, you're essentially sanding away at sensitive tissue. Even a high-quality moisturizing lotion designed for skin won't protect internal structures the way a medical-grade, water or silicone-based lubricant will. And it's not just about comfort. These repeated abrasions can create entry points for bacteria, raising the risk of infection in a gland already prone to congestion. Think of your prostate like a sophisticated filter. It needs smooth, controlled flow to work optimally. When you skip the lube, you disrupt that flow, literally tearing up the filter. Over weeks and months, what starts as minor discomfort can evolve into chronic prostatitis, symptoms, painful urination, pelvic heaviness, and that nagging sense that something isn't right down there. The fix: always choose a sterile, body-safe lubricant and apply liberally before any self-stimulation begins. A little extra glide goes a long way in preserving tissue integrity and in the long run saving you from doctor visits and unpleasant treatments. In the next section, we'll discuss why giving your body time to recover between sessions is just as crucial as technique and lubrication. Stay with me. Mistake number 3. Ignoring cool-down periods. In the rush to relieve tension or boredom, many men jump straight into another session the moment they finish. No rest, no pause. But just like a workout, your prostate and surrounding tissues need recovery time. When you skip that cool-down period, the minor inflammation from one session never has a chance to subside before the next begins. Picture exercising without rest. Your muscles grow stiff, you risk injury, and performance suffers. The prostate is no different. Immediately re-stimulating an already inflamed gland compounds swelling, prolongs congestion, and amplifies discomfort. And because each session starts on already irritated tissue, the risk of microtears and the inflammatory cascade that follows grows exponentially. I've seen patients who believe frequent self-relief was harmless stress relief, only to find themselves stuck in a cycle of pelvic pain and urinary urgency. They'd go from one session to the next, never letting their bodies clear the inflammatory signals before repeating the damage. To break this cycle, think of each session as part of a balanced routine, intense moments followed by intentional rest. Whether it's a few hours or a full day, allowing time for tissues to heal prevents inflammation from accumulating, and that simple pause can make all the difference for long-term prostate comfort. Next, we'll expose another everyday habit that many men overlook, one that involves the items you use, not just the timing. Let's move on to mistake number 4. Mistake number 4, using inappropriate tools or objects. Many men assume that anything goes when it comes to self-relief. After all, it's a private moment, right? But here's the danger. Household items or improvised devices may introduce sharp edges, uneven surfaces, or toxic materials that wreak havoc on your prostate. Picture inserting a rigid object that wasn't designed for delicate anatomy. Tiny nicks and unseen tears become the norm, not the exception. Even seemingly harmless objects like shower heads, rolled up towels, or custom attachments can harbor bacteria if not cleaned meticulously. Once introduced into the urethra or pressed against the prostate, those pathogens can travel directly into the gland, fueling infection and stubborn inflammation. I've treated patients whose chronic prostatitis traced back to an unsterile toy or a clumsy DIY device that they thought was an upgrade. Beyond contamination, mismatched shapes and sizes disrupt the natural flow of fluid. Instead of moving smoothly, secretions stagnate, creating pockets of congestion that linger long after the session ends. Over time, that stagnation leads to discomfort, swelling, and ironically reduced sensitivity, which then prompts men to apply even more force or experiment with riskier tools. It becomes a vicious cycle. The takeaway: your prostate isn't a workshop. Keep it simple and safe. Avoid anything not explicitly designed for internal use. And if you do choose a toy, ensure it's medical-grade, body-safe, and easy to sterilize. In the next section, we'll reveal why even the frequency of your routine, too much or too little, can tip the balance from healthy to harmful. Stay tuned. Mistake number 5, excessive frequency or infrequency balance is everything, and that applies to how often you relieve yourself. Some men believe that daily sessions are the key to stress relief and prostate health, while others think rare marathon sessions are harmless. In reality, both extremes can backfire. On one hand, too much frequency, multiple sessions a day, means your prostate never fully recovers. Inflammation builds up, congestion worsens, and microdamage accumulates faster than your body can repair it. You may think that frequent relief is harmless, but it's like running a high-mileage engine without ever changing the oil. Inevitably, you'll experience wear and tear. On the other hand, going weeks without any self-stimulation isn't risk-free either. Prostate fluid that normally flushes out during ejaculation can stagnate, leading to congestion and discomfort. It's like a river that stops flowing. Stagnant water becomes a breeding ground for bacteria and inflammation. So what's the sweet spot? For most men over 60, aim for consistency: 2 to 3 sessions per week, allowing at least 1 full day of rest between. This frequency supports natural fluid turnover without overloading your system, keeping tissues supple and minimizing chronic swelling. By finding your personal rhythm, you maintain the benefits of self-relief, stress reduction, mood boost, better sleep without sacrificing prostate health. In the next section, we'll explore a habit many overlook entirely: strengthening the muscles that support your prostate. Mistake number 6, neglecting pelvic floor. Strengthening. Here's a factor most men don't consider: the strength of your pelvic floor muscles directly influences prostate health. These muscles cradle the prostate and bladder, aiding in fluid drainage and supporting healthy circulation. When they're weak, you risk chronic congestion. Think of it like a sink with a slow drain. Without regular pelvic floor engagement, secretions and inflammatory byproducts linger around the gland, fueling discomfort, swelling, and an increased infection risk. In fact, many men with stubborn prostatitis show clear signs of underactive pelvic floor muscles when we run pressure tests. They're essentially missing an internal pump that keeps things moving. The good news: you can strengthen these muscles with simple exercises commonly known as Kegels that take seconds to perform and can be done anywhere. Squeeze the muscles you'd use to stop urination, midstream, hold for 5 seconds, then release for 5. Repeat 10 times, 3 times a day. Over weeks, you'll notice improved control, reduced pelvic heaviness, and better prostate fluid turnover. Adding this routine into your day complements safer self-stimulation by improving drainage between sessions and reducing the buildup that leads to inflammation. Imagine giving your prostate its own personal maintenance crew, clearing away the leftovers of each session so you start fresh every time. In the next section, we'll tie everything together with a summary of safe practices and healthy alternatives. Your roadmap to enjoying self-relief without compromising prostate wellness. Safe masturbation practices and healthy alternatives. Now that we've uncovered the 6 habits that can harm your prostate, let's flip the script and talk about how to keep self-relief beneficial and safe. First, adopt a gentle, mindful technique. Think of your touch as a whisper, not a hammer strike. Maintain a light grip, moderate pace, and focus on enjoying slow, controlled sensations rather than chasing an aggressive peak. Next, always use a medical-grade lubricant. Apply liberally before each session to ensure smooth glide and protect delicate tissues. Whether you choose a water-based or silicone formula, make sure it's unscented, sterile, and designed for internal use. A well-lubricated session isn't just more comfortable, it safeguards your prostate from microabrasions and bacterial entry. Third, schedule intentional rest. Aim for 2 to 3 sessions per week with at least 1 full day of recovery in between. Treat self-relief like any other wellness habit, balance periods of activity with mindful downtime. During rest days, consider gentle pelvic floor stretches or relaxation techniques to support circulation without direct stimulation. Fourth, stick to body-safe toys if you enjoy variety. Choose devices specifically engineered for prostate and urethral use, made from non-porous materials like medical-grade silicone or stainless steel. Clean thoroughly after every use with antibacterial soap and store in a dry, protected case to prevent contamination. Finally, explore healthy alternatives that complement or replace self-stimulation when you need a break. Deep breathing exercises, mindfulness, meditation, light, aerobic activity, or even massage of surrounding muscle groups can relieve stress and tension without taxing your prostate. Yoga poses that open the hips or gentle walking can improve pelvic circulation and reduce congestion. By integrating these safe practices and mixing in alternative outlets for stress relief, you'll preserve prostate health, reduce inflammation, and enjoy peace of mind. Up next, I'll share a simple daily routine you can follow to keep your prostate in peak condition every single day. Daily prostate-supporting routine mornings set the tone for prostate health. So start each day with a simple routine that takes less than 5 minutes. First, hydrate with a full glass of water, preferably room temperature, to kickstart circulation and help flush lingering fluids from overnight. Next, find a comfortable seated or standing position and perform 10 slow pelvic floor squeezes. Tighten the muscles as if stopping urine hold for 5 seconds, then release for 5 more. Focus on controlled breaths. Inhale as you squeeze, exhale as you release to maximize oxygen flow and muscle engagement. After your Kegels, take a moment for gentle hip opening stretches. Place one ankle over the opposite knee, lean forward slightly and hold for 20 seconds on each side. These stretches ease tension in surrounding muscles and improve pelvic blood flow. Think of it as unclogging the pipes before you even need them. Finally, incorporate an anti-inflammatory boost. Add a sprinkle of ground turmeric or a squeeze of lemon to your morning tea or coffee. Turmeric's curcumin compound helps calm internal inflammation, supporting prostate comfort throughout the day. By repeating this 5-minute sequence each morning, water Kegel stretches, and a turmeric boost, you create an internal environment less prone to congestion and irritation. It's a small investment of time that pays dividends in reduced inflammation, fewer discomfort flare-ups, and a prostate that feels more resilient session after session. When to seek professional help? Even with the safest habits, there comes a point when professional evaluation is essential. If you experience persistent pelvic pain that lasts more than 2 weeks sharp, or burning sensations during urination, or notice blood in your semen or urine, those are red flags you shouldn't ignore. Likewise, if you find yourself rushing to the bathroom more than 8 times a day, or struggling to fully empty your bladder, it's time to talk to a urologist. Don't wait until discomfort becomes unbearable. Early intervention can prevent complications like chronic prostatitis, urinary retention, or infection. A simple office exam, a quick ultrasound, or a non-invasive urinary flow test can pinpoint the issue and guide targeted treatment. And if you've tried adjusting your self-care routine for a month without relief, that tells us it's no longer just a habit problem, it's a medical one. Remember, asking for help isn't a sign of weakness. It's a proactive step toward lasting prostate health. Your urology specialist can recommend personalized therapies, whether prescription medications to reduce inflammation, minimally invasive procedures to relieve blockage, or specialized pelvic floor rehabilitation programs. If any of these warning signs resonate with you, pause your routine and schedule an appointment. Your prostate and your quality of life will thank you for taking action before a small issue turns into a major one. Conclusion: You've just learned the 6 most common self-pleasure mistakes that can silently harm your prostate and the simple strategies to keep it healthy for decades to come. Remember, a gentle touch, proper lubrication, intentional rest, safe tools, balanced frequency, and a strong pelvic floor are your prostate's best allies. If you found this information eye-opening, hit that like button and subscribe for more expert-backed advice tailored to men over 60. Download our free prostate health checklist in the description below. It's packed with tips, routines, and reminders to keep you on track. And don't forget to share this video with friends or family who might be making these very mistakes without even knowing it. Your prostate health is too important to leave to chance. Take action today, implement these changes, and enjoy the peace of mind that comes with knowing you're protecting one of your body's most vital glands. Thanks for watching. I'm Dr. Henry Carter, wishing you health, comfort, and confidence in every stage of life.